Hi guys, welcome back to my channel. As I had promised before, today what we are starting is the new series known as How to Draw This. Alright, in the first video today what we are going to draw is the anatomical structure or the anatomical drawings for the thoracic inlet, or also known as the superior thoracic aperture. In this topic there are mainly two diagrams which are important. First one is the diagram about the boundaries of the aperture, and second is the structures which pass through the aperture. So first we are going to take up the diagram is that of the boundaries. Alright, first of all will be your boundaries. Now the boundaries which we are going to draw or which we are going to show in this diagram are mainly the anterior and the posterior boundary. Now our thoracic inlet is formed anteriorly by the Manubrium Sternum, the upper end of the Manubrium Sternum, and posteriorly by the upper end of the first thoracic vertebrae. So how will we draw this diagram? First of all, you can mark a small area and draw a thin cylindrical structure. Okay, this is your thin cylindrical structure. This will be your Manubrium Sternum. Now what you can do is you can draw a straight line approximately from here, the perpendicular from here, a dotted one. Alright. Now the first upper end of the Manubrium Sternum usually lies in line with the upper end of the third thoracic vertebrae. Okay, so somewhere here will be your third thoracic vertebrae. Now the thoracic spine is in the kyphotic curvature. So what you can do to make the diagram easy, you can draw a very thin or very light line indicating the curvature. Okay, now it will be much easier to complete the diagram. First of all, over here draw the structure of your third thoracic vertebrae. Okay, and here will be your fourth thoracic vertebrae. Alright, this in between is your intervertebral disc. Now what you have to make sure is that the lower end of your Manubrium Sternum comes almost in line with your lower end of your fourth thoracic vertebrae. Alright, now over here we will complete the thoracic vertebra by drawing another intervertebral disc. On top of that will be our T2 spine. Okay, and above that will be our again an intervertebral disc, and on top of it will be our T1 spine, right? So this is your T1, T2, T3 and T4. Okay, so these are your thoracic vertebrae. Now this structure, this border and this border, we have to connect using a scale. When we draw a straight line, what this gives us is the plane of the, this here is the plane of thoracic inlet. Okay, thoracic inlet. This is the plane of thoracic inlet. Now what you do is you draw one straight line from the upper end of the T1 vertebrae towards the Manubrium Sternum, a dotted line. The importance of this line is that you can show the angle which is formed here. This is a 45-degree angle, and what you can also show is the distance. This distance can be shown over here. This distance is 1.5 inch. Alright, this is your 1.5 inch. Now to mark the diagram, here will be your upper end of posterior border. Always complete the entire thing. I had written it right that, but always complete the entire word. Do not use short forms in the exams as much as possible, especially if they are made by yourself. And this here will be your upper end of anterior border. And that's it. Over here you can also mention the Manubrium sternum, this along with this can be your intervertebral disc. All right, these can be as thoracic vertebra. Okay, so that is all for this diagram of boundaries of your thoracic inlet or the superior thoracic aperture. Alright guys, so this is how the end result is. I have colored this diagram so that you can see how it is labeled and how well it can look. You obviously do not need to color it during your examinations, but this is just to give you an overlook how your diagram should look. Okay, and with this we are completing the structure of the boundaries of the thoracic inlet. In the next video you will see the structures about the diagram about the structures which pass through the thoracic inlet. Okay, and if you want to learn in detail about thoracic inlet, like how to remember the diagrams or how to remember the structures which pass through the diagrams, because there are many, so that video will be coming out this Sunday. Okay, so stay tuned for that. I'll see you guys next time. Bye.